thanks a lot for your comments. You said a lot of the things I was going to say. And I will spare you anything very long. I appreciate receiving this award. Thank you very much for the committee. I hope that the message in that which you just heard, and I want to reemphasize, and what I wanted to say was that the most important thing that I think that we can do with regard to our younger colleagues, everything from our trainees to our the faculty who are not as experienced or as old as we are, is to teach them the concept of ignoring dogma and instead look at what they see in front of them and be willing to push it. And as you said, that really was something that I was lucky enough to do right from the beginning. I actually wanted to start with doing lymphoma, and there was a fellow ahead of me, and so they said, you can't do that, you go do AML. And that's how, I mean, I reviewed all the patients that had ever been seen at the University of Minnesota, and you know, that it became clear that the older patients, they could also be treated, and that it was important to do something different. And by publishing something that was so contrary to the dogma of the time was incredibly useful in terms of, I mean, it puts you on the map in a way you never forget. And I think, you know, that's one of the things that we still have a long way to go in terms of seeing to it that the younger generation understands that it's okay to come up with something that other people don't believe in, and if it's something that you see and it's worth your pursuing it. I think that's how all great inventions occur. And that's more important than what journal you publish it in or anything else. As a matter of fact, the more unusual you come up with, the less likely you are to get it into a decent journal. So, you know, the important thing is that people understand that the importance is what they look at and they believe and they learn, and that's what we want them to do, and that's how medicine moves ahead. So thank you very much for giving me this.